after the presentation. And also the number that you see on your screen right now is the number that you can call to get a personal appointment with a SHIP counselor. And these SHIP counselors, as you probably already know, this is a volunteer basis. These are people that are not affiliated with any particular insurance, and they are trained to help you navigate the system and get the best plan for you. As you know, open enrollment is I think next week, I don't know the dates off the top of my head, but this
October 15th through December 7th.
How could you forget December 7th? That date is like, that one sticks out in your head. But so I thank Brittany for coming today, and her colleague Randy MacBlane for being on this call and for doing this program for us. And if you did not, by the way, I didn't finish my thought. If you did not register through the system, put your email address if you want this, and then I will send it to you separately. So if you want this program, this presentation, just put your name in the chat. That's only if you signed up through the hyperlink or the 818 meeting ID. I'm not making any sense this morning. Why don't you make some sense, Randy? Randy and Brittany, thank you so much. Welcome.
You're welcome. No problem. Hi, my name is Randy MacBlane. I'm a volunteer SHIP counselor, as Michelle. I think you covered about 3 of my slides already, Michelle. Thank you. As Michelle said, we're tight on time, so I'm going to move quickly. Some of the slides, you'll see a bunch of text. I won't cover it all. I'll probably do an overview. So you'll have the slides. If you have questions right away, put them in the chat. If you think of questions later, call that SHIP number. As I mentioned to Michelle earlier, you'll either get an answering machine or you'll get a trained SHIP counselor answering the phone. So if you got a quick question, they'll usually be able to answer it right away. If you want an appointment, they'll send that out to one of the volunteer counselors. They'll get back to you. So if you take one thing away from this meeting, it's that phone number. That'll be the most important thing. All right, so let's, there's a lot to unpack with Medicare. We're going to do an overview. So like I said, if it's confusing, don't worry. Give us a call. We can help you through that. I'd say that phone number is your #1 resource. The next one I would point to you is referenced in this slide. It's a booklet called Medicare In. If you're in Medicare, it's sent out every year. Actually, I don't know if they send physical copies anymore. I think you can request one. I prefer there's a PDF you can get downloaded. I prefer that because if I know what I'm looking for, but I don't know where it is, in a PDF, you can search for a word or a term or something. And I find that kind of handy. Michelle, as she said, is going to share the slides. I put them into a PDF file, 2 per page. So she'll send those out to you. We're not going to go over all the slides you'll see in that packet because there is a lot of detail in here. So feel free to go through it. And like I said, if you have any questions, give us a call. Brittany's on the line. She's the coordinator of the Essex County program. So she's monitoring the chat. She may be able to answer a quick question there, but she'll collect them up. And if we can, we'll get to them at the end. Otherwise, we'll get back to you offline. So Michelle gave a good overview of the SHIP program. It's a federally funded program. It's the funding goes toward the training and sort of the overarching educational materials, collateral that we use, and sort of state agency that manages the program and so on. Most of the work is done by volunteer counselors, and we go through about, I think it's 5 or 6 full days of training and then update training every year. And that being said, we don't know everything, but the good news is we've got Brittany and we've got state representatives we can go to with tricky questions. So we got a lot of resources at our disposal. So I don't know what the population is of people on the call, but basically if you're a U.S. citizen or U.S. resident living for 5 years in the U.S. and you're age 65 or older, you're eligible for Medicare. Whether you're automatically enrolled or not, whether the premiums come out of your Social Security check, it depends on your situation. Those are things we can go over with you one-on-one. There's some information here in the slides. There's also a slide on the next page that we're going to skip that talks about eligibility for people who are disabled or have certain situations around end-stage renal disease or ALS, that sort of thing. So there are ways people can get a Medicare if they're under 65. Again, look at the packet Michelle sends. There's some information there. If you think that applies to you, give us a call and we can walk through that with you. So it can be a little daunting navigating Medicare, not just enrolling, but especially this time of year when all the marketing literature and information comes out around open enrollment. So what we want to do is give you an overview of both enrolling in Medicare, what open enrollment means, what the options are, and so on. We're going to try and help you there. Like I said, that phone number and the Medicare In booklet, both very good resources to help you. When it comes time to enroll in Medicare, you can do it in a number of ways. You can contact Social Security by phone, online, or you can make an appointment and go into an office. For those of you who will be turning 65, you have a 7-month window. I'm going to show a picture on the next slide that'll maybe show that a little better in which to enroll. If you're already receiving Social Security benefits when you turn 65, you'll be automatically enrolled in Part A and Part B. But you're not done. So don't think, great, I'm enrolled, all done. So there's some other things you want to pay attention to. We'll talk about that. So this is the picture. So if you're turning 65 in, let's say, December of this year, so 3 months before, so November, October, so starting September of this year, you could enroll in Medicare. It'd be effective the month of your 65th birthday. You have until 3 months after your 65th birthday to enroll. However, your active coverage will be delayed if you wait until after your birthday. So our recommendation, if you know this is coming, you want to enroll, take care of it right away, 3 months before your birthday. That's the best way to do it. So Medicare Part A, generally that's premium free. The exception is if you've not worked, either you or your spouse have not worked 10 years paying into Social Security. The vast majority of people get that premium free. And generally you want to and will be enrolled in that when you turn 65. The only minor exception is if you have a health savings account and want to keep contributing to it. In general, Medicare and contributing to an HSA are mutually exclusive. So you can only do one or the other. You can have an HSA when you're on Medicare and draw from it to pay premiums and copays and so on, but you can't contribute to it. That's a rare case. Generally, you'll enroll in Part A when you're 65. Many employer plans and other plans will actually consider Medicare to be primary for hospital coverage. So you want to be sure that's taken care of. Now, do you want to enroll in Part B? And we're going to go over what these are, but A generally covers hospitals, B covers doctors and outpatient services. So do you want B? Well, it's a good question because B has a premium to it. So if you don't need it, you don't want to incur the premium. So you got to do a little homework. If you're not sure if this sort of confuses you, give us a call. But basically, if you're employed, actively employed, so not on COBRA or retirement coverage or anything like that, and you're employed by what's called a large employer by Medicare, you can stay on your employer's plan and delay your enrollment in Part B. So you might ask, why is it important to enroll in Part B as soon as I have to? The reason is if Medicare thinks you should be enrolled in Part B and you don't, and you enroll later, you'll incur a penalty. So it's important to understand whether Medicare is requiring you to enroll or not. If you're not sure, again, give us a call. And the large employer thing is kind of interesting because I've actually run into people who work for small, like a doctor's office or something like that, but in a lot of cases, those are enrolled through a larger group. And so if you're not sure if you're a large employer, best thing is to talk to your human resources department and find out. They'll know. For those of you on Medicare, you've probably already gotten a new Medicare card. Medicare switched over from a Social Security number based identifier to a randomly generated identifier number. Just be aware, if you're on Medicare, and you have not gotten a card that looks like this, contact Social Security because you should have one. Okay, so now enrolling in Medicare and staying in Medicare, there's basically two ways to enroll or engage with Medicare. So we're going to start talking about what's called original Medicare. This is more of a traditional kind of insurance plan where you can go to any physician, any hospital. Now, in this case, they have to accept Medicare, but most do. But it's more of a traditional plan. There'll be co-pays and deductibles and so on. In original Medicare, Part A covers your hospital insurance. So anything that has to do with a hospital. And we're going to look at that in just a little bit more detail in a second. And Part B covers doctors, outpatient services, basically any non-drug related medical situations outside of the hospital. So now in A, and I'm not going to go into the detail here. The information is here. You'll see a similar slide next for Part B. But for all these parts, there are premiums, deductibles, and copays. So that's important to understand. In Part A, the premium is generally zero, although there are cases where it's not. This chart covers the deductibles and copays. As you can see, these can add up. So it's important to understand, what these might be. And this is also very important to remember when we get to the discussion about Medigap supplemental plans, which can help you address the cost sharing shown on this slide. Oh, I'm sorry. One thing I forgot to say about the prior slide. The numbers you're seeing on this deck are for 2020 in general. We don't have the 2021 information yet. So when that comes out, we'll have updated information. You can generally expect the numbers to tick up a bit, but usually not a lot. So we'll see when it comes out. So Part B, again, a premium, deductible, and a copay. The premiums here are usually about $145 a month. One thing to note there, and there's a chart that I'm not going to show here, is if your income is high enough, that premium starts to go up. So if you get the deck, you can look at that next slide and see if you fall into a category where your premium is going to be higher than that. The deductible is generally not very high. It's about $198 in 2020 for the year. The most important thing to look at here is a 20% coinsurance for most Part B services. So that's where if you don't have a supplemental plan, you're going to have a significant amount of out-of-pocket if you're active with physicians and so on. So that's important to remember. And we'll get to Medigap plans later. They can help you cover those cost sharing. So it's important to know that, at one point in time, people would think Medicare is free and covered by your, Medicare payroll tax deduction. That's true for Part A, but it's not for Part B and other parts of Medicare. So don't be surprised if you see deductions from your Social Security check or you need to make a premium payment to maintain your medical coverage. So what's missing? So we talked about hospital coverage and we talked about doctors and outpatient services. Well, the prescription drugs are the big missing piece here. So we're going to talk about that a bit. It's important to remember that the coverage for prescription drugs is separate from Part A, B, and the supplemental plan. So it stands alone here with respect to the premium, the deductible, the co-pays, and so on. So remember when we talk about Medigap covering gaps in your coverage, it doesn't address prescription drugs. So this prescription drugs stand on their own. So should you enroll in Part D? This is a little trickier than the Part B. There's a similar consideration in that if you don't have what Medicare calls creditable drug coverage when it's first required, when you first go on to Medicare and you later enroll, again, there's going to be a penalty. The difference here is that there are more ways to have creditable drug coverage than there are to have, what equates to Part B coverage. So for creditable drug coverage, you can be retired. you can have drug coverage through a retirement plan, spouse's plan. It doesn't have to be a large active employment situation. As long as it's what's called creditable, you don't need to enroll in a Medicare Part D plan. If you're not sure if your plan through your employer or your retirement plan is creditable, again, talk to the administrator of that plan. They should be able to tell you. That should be a pretty common question that they get. And as long as that's creditable, you can stay on that until that's not an option or until you want to switch. When it's time, you want to get your Medicare Part D prescription coverage, even if you don't take any prescription medication at the time, because if you enroll later, there's going to be a penalty. And I've actually seen cases where people haven't had prescriptions, have waited as much as 10 years, and then have a very significant penalty because then they encountered a health situation where they needed prescription coverage. So, our advice is enroll when you have to, even if you don't take anything. There are some drug plans that have premiums as low as, I'm going to guess, I'm not sure the exact number, around $15 a month. You can enroll in one of those and you can switch every year. So if you're not anything, enroll in a low-cost plan. And if you later encounter a health situation where you need some expensive medications, you can switch plans the next year. So there's a penalty for late enrollment. The thing I'll highlight here is these numbers are not exact because it's a formula Medicare comes up with based on baseline premiums each year for Part D plans. But it can amount to about $50 a year for a 1-year delay and so on, and that can go up. So it's not insignificant. I'm not going to dive into this except to say Part D coverage can be complicated. There is a deductible. A lot of plans only apply to the deductible to brand name or higher cost drugs, so that's a little fuzzy. There are these thresholds where if you have had a certain amount of out-of-pocket costs, the copays and coinsurance changes. There's this thing called the donut hole. There's something called catastrophic coverage. I'm not going to dive into it right now. The thing to remember is that as you go along through the year, what you pay for medication might change because of these thresholds. So it makes it very difficult to understand what the best plan for you is. And we're going to get to how to address that in a moment. The other thing that can factor into this is preferred pharmacies. So many of the plans have what's called a preferred pharmacy. It usually does not mean you have to go to that pharmacy, but what it does mean is if you go to that pharmacy, you'll get better pricing on your medications. So that's important to consider too. And depending on your situation, you may be locked into a certain pharmacy because they deliver, or they're convenient, or they're, or other considerations. So it's comparing drug plans is very difficult because the actual cost to you over a year can vary based on a number of things: premiums, the deductibles, the copays, what's called the formulary. So the formulary is different for each drug plan. It lists what drugs they cover. That donut hole we talked about, catastrophic coverage, preferred pharmacies. So you can see your head starts spinning when you think about it. But Medicare actually is a very good tool that helps you compare drug plans. It can be a little intimidating for the first time you do it. We at SHIP are happy to help run through this with you. In fact, that's a lot of what we do during open enrollment, is help people evaluate drug plans. But it is online. And what it does is it lets you input your regular medications, your preferred pharmacy, and it will give you a list of all the drug plans available in the state, in New Jersey, and their estimated total annual costs. So that'll factor all those things in we talked about and say, well, if you go with this plan and you took all the costs from you, here's what it'll cost you. And you can actually dive into that and find out if a particular plan covers all your drugs or not. There's a lot of detail there. I think it's a really useful tool. It's even more useful if you enroll in what's called mymedicare.gov, because that, based on your history, will track medications you take and will streamline the process of inputting what you take. It'll track your evaluation of the drug plans and so on. So I mentioned mymedicare.gov. So there's sort of two ways to do the plan finder. One, you can continue what they call continue without logging in. That works. We do that all the time. Essentially what happens is you input all the information, you get a report, and then it loses all that information. So it's a little tedious, but if you have a mymedicare.gov account, you can input your drug list or pull one from your history and edit it, and it'll maintain it in the account. So that makes it easier that now and then in coming years, assuming your medications don't change too much, you can go in and tweak that list the next year, and it's an easy way to then do a search on the drug plans. So you want to compare all these things when you're comparing plans. I would really jump back to the plan finder. I think it's the most effective way to do it because it's so complicated when you look at how these plans are set up. So the plan finder is a really useful tool. So one thing people ask is, what if your prescription is not covered by the plan? So I'm actually going to jump to number 3 first and just remind everybody that open enrollment that Michelle mentioned between October 15th and December 7th, you can change every year your drug plan. In fact, I would strongly encourage everybody to review through the plan finder their drug plan every year. The reason being that these plans change every year, and the one that's best for you this year may not be the best for you next year, even if your medications haven't changed. And we saw a case, I guess last year or the year before, where one plan premium went from about $30 a month to $80 a month with really no change in what it was covering. And so it went from what may have been the best plan for some people to really not so good for those same people. So important to do that. So back to number 1, if your prescription your doctor wants you to take is not covered by your plan, the first thing should be to talk to your physician. So look, it's not covered. Is there an alternative in the same family that might be covered by this plan that you're okay with me taking? So talk to your physician. If the physician says, no, you can't switch drugs, this is the one you have to have, you can request an exception. And if it's approved, it'll be covered, but it'll be a higher cost. And then there's a way to appeal. And these are all things we can help with. So those are important to understand. So that covered prescription coverage. Now I want to go back to the stuff that in Part A and Part B that Medicare doesn't cover. The big one is the 20% copay on Part B, but this also includes the deductibles and copays for hospital stays and so on. That's where we get to what's called Medicare supplemental insurance, also called Medigap policies. In some cases, people have retirement plans that fill this niche. So your retiree plan may be your Medigap plan. And that's an area that we're not trained in, but you can talk to your retiree benefits coordinator and understand how that works. So we're going to focus on the Medigap supplemental plan today. Michelle, we're doing okay on time, right?
Yeah, we're fine.
Okay, good, thanks. So this is all, again, part of original Medicare. We didn't get to the right side of that picture yet, and we will. But original Medicare covers, A covers hospital, B covers doctors, D covers prescription drugs, and what Medigap covers is some or most of the deductibles and copays with A and B. And we're going to see a chart. There are different kinds of plans. There are 10 standardized policies available. They're labeled A through N. You'll notice A through N is actually more than 10 letters. What happens over time is some standardized policy types get obsoleted and replaced by new ones. And there's one we'll talk about in a moment. What happens is if you're on one of those, you can maintain it for the rest of your life, but new people can't get that plan. So we'll talk about what those are. Basically, the each letter defines the coverage that's offered. The government, Medicare, defines what that coverage is. Any insurer offering you a plan with a certain letter, let's say letter A, has to offer exactly identical coverage. No difference. But there will be different premiums. And that's basically based on each insurer's experience with their insurance pool and so on. It's a little fuzzy as to how they come up with that, but the premium costs are different. You can go to any doctor, hospital, provider that accepts Medicare in any state. So with original Medicare, this is a national coverage. So you can go any doctor anywhere that's in the Medicare program, which is quite a few. So it's not really a restrictive thing. If you travel back, if you spend 6 months in New Jersey and 6 months in Florida or somewhere else, not a problem. This coverage will go with you. You're in good shape. So this, if you use Medigap, is another premium. So if you're on original Medicare, you should be premium free on A generally. You'll have a premium for B, you'll have a premium for D, and you'll have a premium for Medigap. So it's important to understand there'll be 3 premiums potentially if you're on original Medicare. And I'd say generally if you're on original Medicare, you're going to want a Medigap because that 20% and those hospital copays without a Medigap plan, and they're not capped, that can quickly add up and sort of overwhelm you. So if you're on original Medicare, I would strongly recommend, a Medigap policy. If that gets too expensive for you, then we're going to talk about, Medicare Advantage, which sometimes can be a more cost-effective approach. We'll talk about that shortly. So the way this works is Medicare, if you go for a service to a doctor or hospital, Medicare will pay their share. That provider will take your Medigap information. They'll then go back to your Medigap insurer, and they'll cover what they're supposed to cover based on your plan. This only covers Medicare services. So as far as what's covered in Medicare, that's where the Medicare In document can give you an idea. The bullet in red here is really important. There's something called guaranteed issue. And that happens when you first enroll in Medicare, and there are some other situations where you're in a guaranteed issue situation. Essentially what that means is if you apply for a Medigap plan, they have to cover you, and they cannot consider your health history either to decide on coverage or to set your premium. Really important. Because if you wait and later in a non-guaranteed issue situation and you have a serious health issue, there's a very good chance you're not going to be able to find a Medigap plan that will accept you. So very important to understand that. And I mentioned that this does not cover prescription drugs, so those are separate. You really got to isolate those. Most Medigap plans are age-based, so what you'll see is as you get older, the premiums will go up. But these are policies you can take with you as you move around the country. Chart, I'm not going to go into this chart in detail, except for a couple of comments. This lists the type of plans in the columns. The stars indicates what's covered. So you can look at the items in the left to see what different plans cover. This chart is a little out of date because it highlights Plan C as what's available for people under 65 on disability. C and F are actually have gone away as of the beginning of 2020 for people who are newly eligible for Medicare. So as of now, I think it's D is the plan for people with disabilities. So if you look at this chart, almost ignore C and F. A lot of people are probably eligible for it. Some of you may be on Medicare and already on it, and that's fine. You can stick with that. For new people, what I've found in working with people in Medigap plans now and looking at the premiums and so on is that the natural replacement for C, which is D, because it covers everything C does except for the Part B deductible, and the natural replacement for F, which is G, which has the same change. It covers everything F does except for the Part B deductible. D and G are generally cheaper than C and F by enough to cover that deductible. So for new people, I really haven't seen a case where it makes sense to look at C and F now, even if they're eligible. Now, if you're already on it, that's fine. You can stick with that. The most common plans I've seen now for people are D and G, reason being they have the broadest coverage. So they cover pretty much everything except the Part B deductible. D also leaves out something called excess or limiting charges. This is an extra 15% some providers can charge and still accept Medicare. So G is the broadest. D is slightly less broad, but those are the two very common ones. The other common one I see is N, because in some cases the premium in N is enough lower than D and G to more than make up for you having to pay a copay on office visits. That really gets into a discussion of, how healthy you are, how often you visit the doctor, that sort of thing, and whether that makes sense. And then looking at the premiums that are available. So this chart is in the slides. It's also in that Medicare In booklet. That'll have an up-to-date chart. So it's a good to look at. The SHIP counselors actually have a tool where we can go in for any age. We can go into the tool and find out the premiums for any Medigap type plan for you. So if you want to see what your options are out there, check. If you've been on Medicare for a while and you're considering changing Medigap plans, the important thing is that you may not be in guaranteed issue. So be sure the new plan will accept you before you cancel the old plan. That's very important. You don't want to lose that one that you've got that they have to give you before you know you can get the other one. There's some resources here to look at Medigap plans. Feel free to take a look at those. There's a good booklet Medicare has. And again, SHIP is available. We can help you walk through that as well if you're interested. So that covers original Medicare. I'm going to talk about what's called Medicare Advantage plan now. You may also hear that called Part C. They're the same thing. Essentially what Medicare Advantage plans are, they combine A, B, and usually the prescription plan. The only reason you would get one without a prescription plan is if you had a retiree plan or something else covering your prescriptions. But it covers all that in one. It's more of an HMO or a PPO style in that it has a network, it's geographically based, that sort of thing. We're going to talk a bit about this. So Medicare Advantage is actually run by insurance companies, not by the federal government. They contract with Medicare to provide your benefits. You still pay your Part B premium. What the government then does is turn around and pays that insurance company some stipend for providing your coverage. So you got to get all your hospital, doctor, and drugs through the plan. They generally will have networks, although some of the PPOs allow you to go out of networks. I've heard sort of mixed things for different plans about how successful people have been with that. So if you're looking at one, I'd dig into that a little bit and see how easy that is to do. In some cases, you might need referrals. So those are sort of the restrictive parts of the plan. The positives to Medicare Advantage plans are that many of them offer extra benefits not covered by original Medicare. So they might provide a vision benefit, a hearing aid benefit, dental, gym discounts, travel to doctors, that sort of thing. Those all sound good. Again, dig into the details because some are fairly limited. Like a lot of the dental services provided are basically for 2 checkup visits per year. And, anything beyond that, it's not covered. So, which is fine. It's a good benefit, but it's important for you to understand what you're getting and not thinking it's a replacement for a full like dental insurance plan or something. So Medicare Advantage has premiums. So in the case of Medicare Advantage, you would pay your Part B premium and you'd have a Medicare Advantage premium. However, in a lot of cases, many of these Advantage plans have a $0 premium. So you can be in a case here where you have just the one premium, the Part B premium. So that's where it can be more cost effective than original Medicare. And some even actually offer a reduction, essentially a rebate to you for your Part B premium. So if the premiums if they have a premium and it's more than $100, you're starting to get into the range where you might be better off even from a cost standpoint of looking back at original Medicare and a Medigap policy. Now, most of these plans are structured, like I said, with a network, they've got a deductible, they've got co-pays for the different services, and they usually set a maximum out of pocket. It's usually around $6,700. So what happens is if you're very healthy, you can do better from a cost standpoint in an Advantage plan, because you could have very low premiums, and since you're not using many services, you won't have many co-pays and so on, and you've saved that premium amount you might have paid to a Medigap plan, a prescription plan. If you have a health issue or concern with that part of your health coverage, then original Medicare is probably better, because even though your premiums might be a little higher, once you get that Medigap plan, other than your prescriptions, you have virtually no out-of-pocket costs for your healthcare coverage. So there's different situations where each one's better. If you're not sure, again, that's something the ship counselors would be happy to work through with you. And again, we're not going to tell you what the right choice is, but we'll help you get the information to think about, what your options are and what you want to do. These are examples of some of the extra benefits offered by Medicare Advantage plans. I'm going to skip over that. Like I said, each one's different. You'll want to look at the details and see if it's useful to you and that sort of thing. So I'd say the most important thing on the Medicare Advantage plans, that the most critical issues I've found talking to people are the physicians and doctors I want to use in the network. Will I be able to continue seeing them? That seems to be the most important. So, you can call the doctor's offices, you can go to the Advantage Plan's website, you can call the Advantage Plan. There are a number of ways to find out. So that's probably number one. The second one would be the drug coverage. So you want to look at the drug coverage, especially if you have any unique or expensive medications. You want to make sure the drug coverage is there. And the other thing I'll touch on here, and when you look at this, is traveling out of state. So because Advantage plans are geography based, in many cases it would be difficult if you spent a considerable amount of time out of state. Like if you were a 6 month person in different states, that might be problematic. Most of these plans will allow you emergency coverage when you're out of state, but not generally easy access to routine healthcare coverage. So if you're going to travel a lot out of state and you think you want one of these, make sure you understand what your coverage will be and that you're okay with it. So this is how to join a new plan. This is really talking about an Advantage plan or a prescription drug plan. There's sort of three things you can join that we've talked about. One is a prescription plan, one is a Medigap plan, and one is an Advantage plan. So right here, we're talking about the Advantage plan and the prescription plan. You can do it by calling Medicare, calling the plan. You can do it on the website. You can actually also do it from the plan finder. When we're looking at drug plans, you can enroll in a drug plan right from the plan finder once you find one you like. If you enroll in a new drug plan, it will automatically disenroll you from your old one or disenroll you from your old Advantage plan, and vice versa. If you enroll in an Advantage plan, it'll disenroll you from your drug plan, or disenroll you from your prior Advantage plan. Very important, if you have coverage from your employer, union, retirement, make sure to check with that benefits administrator. Do you understand what's going to happen to that coverage when you enroll in something in Medicare before you do it? Very important. So open enrollment. There's a special Medicare Advantage open enrollment period. Michelle and Brittany talked earlier. There's the general open enrollment period, which I think is on a subsequent slide here, that goes from October 15th to December 7th. The special Medicare Advantage plan open enrollment period has been added recently. And basically, if you're in an Advantage plan between January 1st and March 31st, you can switch to another one, or you can switch from Advantage to original Medicare with a Part D drug plan. That's not something that's generally an option for people on original Medicare. So it's an important window to be aware of. The other special situation with Advantage plan is what's called a no-risk trial situation. So if you're basically if you enroll anytime in the first 12 months, you can switch out of it. Because people sometimes are not happy with the coverage or happy with the choice of physicians and that sort of thing. I've actually run into a case recently where someone was approached by a broker for an Advantage plan and convinced to switch to one, even though they didn't realize what they were signing up for. So I've seen that. So once they got into it, they didn't like it at all because it restricted their coverage in a way that wasn't acceptable to them. So they were actually allowed to switch out based on misrepresentation by the broker. But this is one where there's no misrepresentation, but you're just not happy with the Advantage plan. And one thing to re-emphasize here is if you're planning to switch from an Advantage plan back to an original plan and you want Medigap, make sure you can get into the Medigap plan first. Talk to the insurer and make sure that they're going to let you in, because you may not be in a guaranteed issue situation. So just to reiterate, these are the two ways you can get Medicare. The one on the left is original Medicare. It's made of a bunch of parts that sort of fit together. The one on the right is sort of an all-in-one plan, HMO PPO style, through an insurer. So we talked a bit about, should I do original or Medicare Advantage? It really depends. There are a lot of considerations. There's some listed here. I've talked about some. If you're not clear, again, give us a call. We can help you think through that, what all the considerations are. Okay, the next thing I'm going to talk about, I'm going to go quickly through this, is there's a number of programs to help with Medicare costs. There are details in the slide deck that I'm not going to go through in the interest of time, but take a look, and if you want more information, you can call us. The Medicaid and Medicare savings programs I'm not going to dive into. Those two are income and asset eligibility programs. So the income has to be at or below a certain level, and your assets have to be at or below a certain level. They're very comprehensive with respect to what they get you access to. So they're very useful programs if you fit the profile. Again, take a look at those slides. If you think you fit, give us a call. Medicaid, you can apply through the county social services office. The numbers 2 through 4, there's actually an online tool you can apply, or there's a paper form you can submit, and we can help you with those. One I do want to show a little bit of detail on, or there's actually two. One's called PAD, the Pharmaceutical Assistance to Aged and Disabled. And the reason I want to show it is I've seen a lot of cases where there's somebody, a widow or widower, living on Social Security alone. And in often cases, if that's your situation, you're going to be eligible for PAD. And a lot of people don't even know it. And PAD is a great program, especially if you have any expensive medications. So it'll pay your Part D premium, and it gets you reduced co-pays for your drugs, which is a huge benefit. So I want to make sure you're aware of this, because I think it's not in the consciousness of a lot of people that might be eligible. So if you think you fit, give us a call. We can help you apply for that. Senior Gold is a little bit higher income level than PAD. So it doesn't pay for your premium, but that does give you reduced copay. That helps if you have some particularly expensive medications. So it's a useful program. And again, there's no cost to you. So it's definitely worth applying for this if you think you're eligible. Like I said, New Jersey Save is a tool that allows you to apply online for PAD, Senior Gold, and the federal extra help programs. It also has help with heating bills and so on. So there's a lot of assistance available if you think you apply. I think you qualify. Give us a call and we can help you apply. Medicare Open Enrollment is October 15th to December 7th. I just want to highlight, you may hear people talk about Marketplace Open Enrollment, November 1st to December 15th. Marketplace is the Affordable Care Act. That's different. The most critical thing here is I don't want people who are looking at Medicare Open Enrollment to think they have until December 15th. Be cognizant of these dates. So during open enrollment, as I mentioned, you can change your drug plan, and I would encourage everyone to look at your drug plan if you're on original Medicare every year. for the reasons we talked about. You can also switch from original Medicare to an Advantage plan or back. If you're going to switch back, like I said, make sure you can get a Medigap plan before you do the switch. And the insurer will be able to walk you through that. Now, Medigap plans don't fit into this open enrollment slot. You can change your Medigap plan anytime. There's no time limitation on that. The restriction there is that guaranteed issue medical underwriting issue. So be careful if you're thinking of switching. I've seen cases, in a lot of cases, if you're on an insurer who has plans across the different types, in many cases, they'll allow you to switch between types without medical underwriting. They're not required to do that, but they might let you. So if you're on N and want to change to G, and you're not sure if you qualify, call your insurer and see if they'll let you do that without medical underwriting. So this is medical. We talked about open enrollment. The changes you make during open enrollment take effect January 1. There's also the special Medicare Advantage open enrollment period, the first quarter of the year. And if you're happy with your current plan, you don't have to do anything. But like I said, I would definitely encourage people to look at their drug plan if they're on original Medicare every year. So just to review, your choices for Medicare, with the left-hand column here, where you have A and B giving your hospital and doctor outpatient services coverage, your Part D prescription drug plan covering your medications, and a supplemental plan, which is optional. You don't have to get that. But I would definitely encourage it if you're on the left-hand side of this chart, that covers the gaps in Part A and Part B, covers deductibles and copays and so on. The right side of the chart is the other choice you have, which is Medicare Advantage plans, also known as Part C. Again, it's an HMO or PPO style network-based prescription plan, or not prescription, I'm sorry, health plan provided by an insurer. They have to cover all Medicare services. They often cover additional services. There are some pros and cons, so it's important to look through those before you make a decision on which side of this chart you want to fit. Due to COVID, Medicare has enacted a number of changes to how Medicare will cover and address certain situations. So I'm not going to go into this in detail, but you'll see things like telehealth and lab tests and so on. There's broader coverage than there was before. Also important, avoid scams. Medicare won't call you to ask for your information, your Medicare number, your social security number, bank information. They won't do that. They won't send representatives to your home. I mentioned a case where I had a client recently who got approached by an agent and was switched, really not understanding what they were doing. So be wary is what I would say. I mean, not that these agents are out to do you harm, but they're out to sell a product. So take what they say with a grain of salt. If you're not sure, ask for information. You can call us to go through it with you and help explain anything they've said to you and let you know what other options you might have to that. So just be careful. Where to get help? The Plan Finder is a great tool. If you're not computer savvy, or if you look at it and you're confused, give us a call. We can go through that. The main thing we need if we go through that with you is a very detailed list of your medications. The best thing when we used to be able to meet with people in person, the best thing is I've asked people to bring them the medicine containers with them, because often there's not just the name of the medication, there's some extra letters, and there's the dosage and the frequency and a lot of information that we sometimes need to enter into the Plan Finder. Short of that, if you have a very detailed list of your medications, including all that information, you could email us or talk us through on the phone. We can run through the Plan Finder for you, or you could do it on your own, like I said. The plans can help you with information. If you need phone numbers for plans and so on, there's a lot of information on the New Jersey SHIP site. There's a link here on this page. So if you go in there, there's a lot of information with lists of insurers for Part D and Medigap, and you'll have phone numbers. You can call them directly, or you can call us. You can call Medicare. And like I said, the Essex County ship line number is that number at the bottom there, the 973-637-1717. And this is just an overview again of what SHIP is. I'm not going to drag you through that, but it's a good service. I mean, the counselors really enjoy doing it. We get to meet a lot of great people, and it's nice to be able to help you navigate something that, it's a little daunting, but it's a good program when you get through it and get signed up on the appropriate services for you. So we're happy to help. And I think that's all I got. So Michelle or Brittany, if you have questions that are lined up, but I know we got to get off for yoga. So.
Okay, thank you, Randy. Yes, we have some questions that were lined up. The first question, somebody asks, how do you get a rebate?
Oh, the Advantage plans that give you a rebate?
Yes.
That's plan by plan. So you would have to, I'm not sure which ones actually offer that. So we'd have to go into individual plans, and then the insurer would give that to you. I assume when you sign up, then every month or maybe every year they would send you something. I'm not quite sure. I just know there are some out there that do that.
Okay, and then we had another question. How do you successfully, have we successfully challenged the tier 4 or 5 level for prescriptions you had to get special approval for?
You mean I assume that's the one where the medication was not on the formulary for the medication? Or
I
for
believe.
Yeah. Well, there is an appeal process. To be honest, I haven't done it, so I would have to look into what that is. I'm not sure if you've done it, Brittany, that appeal process.
No. Yeah.
So I'm not sure. It's out there, and we could find out. Like I said, Brittany and I have access to a lot of resources at the state level. So for a question like that, I'd probably go to them and get some guidance. But I don't know offhand, unfortunately.
It says, how is it that a doctor accepts Medicare but not Advantage plan?
Wait, I'd say that again. I didn't follow that.
How is it that a doctor accepts Medicare but not an Advantage plan? Do you mean original Medicare? That's what I'm assuming.
Yeah. So for original Medicare, doctor or hospital accepts what's called Medicare assignment. Many do. It's quite broad. So especially doctors who specialize in older clients and that sort of thing. So it's pretty common. I haven't really heard people have an issue finding a doctor. Advantage plans are more like an HMO style, where the insurer goes out to a network of doctors and signs them up. And so they have to be in that insurer's network. Now the PPO plans, like there are a few, I know Clover is a PPO, and I think some of the others are PPOs. Preferred providers state that you can go to any doctor who accepts Medicare assignment. I've heard sort of mixed success for different plans with that. So the best thing I can say is call the insurer if you have specific physicians, talk it through with them. If you have friends that are on that plan, see what their experience has been and that sort of thing.
And one last question is, what is medical underwriting?
Medical underwriting is when, if you apply for a Medigap plan, they ask for your medical history. Usually I think it's a form you fill out. I don't know if any of them actually make you have an exam or not. And based on that, they will decide A, whether to insure you or not, and B, whether they're going to give you the normal rate or perhaps a higher rate because you have some medical risk. In some cases, they may, based on that, accept you, but say that pre-existing condition isn't covered for a certain period of time. So they're allowed to do that. So basically, medical underwriting means you've got to have a medical evaluation with them before they decide whether they're going to accept you and under what terms.
Okay, so it's 10:55, Michelle, and we finished on time.
Thank you so much. Thanks everybody out there. Again, you can stay on long enough to put your email address in the chat. If you wanted this presentation, I can send it to you. I've already sent it to a bunch of folks. and I'll get to everybody else. But if you want it and you signed up the old-fashioned way, please put your email in so that I know that you want it. All right. Well, thank you so much, Randy, and
You're welcome.
for coming and for doing this. Again, if you need the number and you don't have it, we could just type that also in, the number. Can we just type that number in?
Yes.
Oh, Brittany, you have it handy?
Yeah. Just put it in the chat. That number is the number to call if you want to make an appointment, if you have like a quick and easy question, or if you want to speak to somebody privately, you can do that. And you'll have a virtual appointment where they'll actually go through your particulars. So there were, Brittany's going to put that number up on the chat. There it is. That's the 973-637-1717. That's the SHIP hotline. That's the number to call for an appointment to have somebody go over all your particulars.
For Essex County only.
Essex County only, correct.
But
Each county has a different number to call.
But if you call us and you're not from Essex County, we can direct you to the proper county. So don't hesitate to call us.
Great. Thank you so much. Thanks, everybody.